This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Alburel injection is a crucial medical treatment used to restore blood volume and manage low albumin levels. Indications and uses. This injection is indicated for the management of hypovolemia, particularly in conditions like burns, adult respiratory distress syndrome, ARDS, and nephrosis. It is also indicated during cardiopulmonary bypass surgeries and for treating hemolytic disease of the newborn. Its role is vital in restoring and maintaining blood volume in patients experiencing reduced blood circulation or low albumin levels. How it works. Alburel injection contains human albumin that increases circulating plasma volume, helping to restore blood volume effectively. Directions for use. Alburel injection must be administered by a healthcare professional, either a doctor or nurse, through an intravenous route. The correct dosage and duration of treatment will be determined based on the patient's age, body weight, and specific medical conditions. It is critical that patients follow the prescribed treatment schedule and communicate with their healthcare provider regarding any missed doses or adjustments needed. Possible side effects. Common side effects may include anaphylactoid reactions such as skin rashes, low blood pressure, and respiratory difficulties. More severe side effects may involve cardiovascular overload and severe allergic reactions. Precautions and warnings. It is essential to exercise caution when administering this injection, especially in patients with heart failure, high blood pressure, or chronic kidney issues. Pregnant and breastfeeding women should consult their healthcare provider before receiving the injection, and it is contraindicated in patients with known allergies to albumin preparations. FAQs. 1. Can this injection be given to infants? Yes, if prescribed by a healthcare provider and dosed appropriately for body weight. 2. What if I miss a dose? Always inform your healthcare provider if you miss a dose. 3. Is it safe during pregnancy? It should be used with caution and only after consulting a doctor. 4. What are the signs of an overdose? Symptoms may include headache, difficulty breathing, and increased blood pressure. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below.